Patients in general, I believe, make decisions in their healthcare primarily if there's pain involved. That causes them to be motivated to pursue, go to a doctor, see a dentist, follow through with treatment or whatever's needed to stop the pain. The interesting thing with gum disease is it doesn't hurt. So many, many times patients can have gum disease for decades and really not be aware of some of the signs of gum disease, such as bleeding gums, maybe even gum infections at times, bad breath, teeth that are changing in their position, spaces are moving, teeth are slowly shifting over time. I think many patients might be in denial or just don't want to realize that, oh, the bone below the gums is slowly disappearing. So I see that quite often. I began performing periodontal surgery right out of dental school. I took advanced training in dental school and felt comfortable building on the techniques that I learned. And over the years, it's been even more of a passion of mine. And I've taken it just a huge number of courses to stay current and try to implement the latest in materials and techniques. So in the field of aspect of connective tissue grafting or covering exposed roots, there's a technique that I really love called Vista. And you can look it up there on YouTube. There are descriptions of it. It's a technique that I use and I have really fantastic results. And I think patients appreciate it. Now, there is some degree of discomfort involved in healing. However, once it's healed and all, it holds up well over time and accomplishes our results. The primary goal in periodontal surgery is saving teeth. And I think patients in general, when they have a particular problem, a periodontal problem or commonly thought of as a gum problem, they would prefer to save the tooth if they could. So we often use surgical techniques where we use bone grafting techniques. So we can use different materials that will result in the body actually growing bone around a tooth so that we can save that tooth long term. And it's really exciting to see those results. So in that periodontal disease primarily does not cause pain. It's very important that we explain to the patient what's going on and that their disease is slowly getting worse. So it's also important to explain that the sooner we treat their problem appropriately, the easier it's going to be on them, actually the less expensive, less pain. It's very advantageous to address these problems very, very early. We can treat the periodontal disease early. Many times surgery is not needed. So it's a fantastic thing for the patient. If it's not early, if it's medium to advanced, then we just want to approach it as carefully as possible and give the patient choices and tell them what can be done. I mean, it's hard to think of just one case. I'm thinking of hundreds of people that felt like they may lose their teeth, and that is a big deal. And so to go about getting control of the disease, all the while, they need to be comfortable with the way we're doing it. And to slowly see progress and to slowly see the body heal. And if we need to take a surgical approach, even with bone grafting or gum grafting, we do that once the patient is completely understanding why they need it and they're motivated to take care of it. And it just becomes a win-win situation where they see progress and success and they get excited about it. And it's exciting for me too.